And welcome back. We have mentioned the term health equity a few times already. Simply put, it mainly refers to the disparity of health and health care among segments of the population, and that touches on a number of health-related issues important to the Asian American and Pacific Islander communities. Joining me to explain more about it and about the organization dedicated to enlightening and empowering the community to learn and take action on the inequity is the founding executive director of Appeal, Rod Liu. Rod, thanks for joining us.
Thank you for having me.
Now, give us an idea, first of all, in terms of what did you and other leaders see in the community that was going on that made you feel like this organization was necessary?
Well, we noticed that there were a lot of smoking that was happening in the Asian American, Native Hawaiian, Pacific Islander community. And as we went across the country, we realized there wasn't the resources to help communities be able to fight that issue. So we started a national organization and a network of community groups across the country to fight tobacco and tobacco industry.
I know your group does a lot of different issues related to health equity, but tobacco and smoking is a big focus. You and I were talking about a little earlier, and I was telling you how I have relatives, nieces and nephews that come from Japan, as well as friends from Hawaii. They all smoke, and they smoke pretty heavily for young people. Is that kind of a cultural thing, or what kind of circumstances are making that happen?
Well, there has been a lot of smoking in Asian countries, and when the restrictions happened here for tobacco control to limit and restrict advertising, the tobacco industry went over to Asia to begin to increase their targeting of communities.
How about for your organization then? Do you plan to go international?
Actually, I'm going next week to China to help work on a youth leadership program that they're interested in starting.
Now, when you have youth leadership, what are you trying to do there, and then what are they expected to do with the population?
Well, our youth leadership work is really about helping to educate youth in Asian American, Native Hawaiian, Pacific Islander communities about the harms of tobacco, but also the role of the tobacco industry in targeting our communities and what to do about it. And what to do about it often involves trying to do prevention work, but it's also in terms of looking at the power of policy change.
Let's talk a little bit about locally and domestically first before we go back to international. What are some of the things that you've seen work locally and in communities here in the United States?
Well, there's a great story of in public health around policy change where smoke-free legislation, tobacco taxes has really impacted being able to lower the prevalence of smoking in the country. But at the same time, we realize that there are groups that are not receiving the same benefits from policy change. So we really need to involve and tailor our efforts for Asian and Pacific Islander communities to be better able to engage in policy change.
How do you do that? I mean, a lot of people need and want to do that. Do you try to appeal mainly to Asian American and Pacific Islander legislators, or where do you start?
Well, I think one of the places to start is what is impacting their communities, starting from the community, looking at leadership development and how that can help to provide skills for being able to do policy change, as well as being able to empower communities to be responsible and to be active in solving their own issues in the community.
Now, I can see where some of this would be effective in the United States and in the kind of communities that we deal with here. When you talk about going international, what are some of the obstacles you're going to have to face? I mean, there's not going to be the same circumstances. There's not going to be the same kind of access to policy leaders. What do you do in terms of on an international level to try to have an impact?
Well, policy change is a very challenging thing, even in this country, where communities, immigrant and refugee communities, may not be used to talking to authority figures. So some of those same dynamics play out when you go internationally, is that there's not and oftentimes that you're interacting with policymakers. So we try to make it so that people understand the power of it, be able to make it easy so that they're in that situation and they can act and influence policymakers.
I guess that's in a way why the empowerment part, the youth leaders are so important, right? Because if you're really going to try to start something within a community, you got to kind of get down there in there and talk to them that way, right?
Absolutely. And that's where we really want to focus, is because we've been doing this work for 20 years and there's been some great successes, but there continues to be disparities and inequities around tobacco. And what we need to be able to solve that is to have a new cadre of leaders that are going to be taking the charge within communities to move forward and address these tobacco inequities.
And what do you do? What do you kind of set them out to do? How do you train them? How do you get them to have that kind of influence that they need to have to get people to change that kind of habit?
Well, one of the things is that people are very busy, so we want to make it fun. So we have a leadership training that is engaging, that is experiential based, and that allows them to take their context of how they're living in their communities and apply the lessons that we're doing. We also work collaboratively across other communities, so it's really important, not just for the Asian American Native Hawaiian community, but also other communities of color to engage together, because when we come together as a force, we have a greater ability of impacting change.
Well, good luck with your project. Thank you for coming on and sharing that with us. And when you come back from China, let us know how you did, okay?
Thank you so much.
All right. Well, thank you very much for doing that. And we want more people to know about Appeal and what people in the community need to be aware of for their own health. Now, up next,